Hello everybody and welcome to our lesson. Our lesson today is about health problems related to obesity, coronary heart diseases, and anorexia nervosa. Let's first start by our objectives for today. By the end of this lesson, you as students should be able to list the causes of coronary heart diseases, define anorexia nervosa, and list the complications caused by anorexia nervosa. Our key terms for today are coronary heart diseases and anorexia nervosa. Let's start first by coronary heart diseases. What are coronary heart diseases? The diseases that involves the reduction of blood flow to the heart muscle are called coronary heart diseases. But what causes these diseases? Coronary heart diseases develop when the major blood vessels that supply your heart with blood, oxygen, and nutrient is damaged either by small blood clot in one of the major branches of the coronary artery causing its blockage, or by narrowing of the coronary arteries due to the build-up of cholesterol and fatty deposits that are called plaque on the inner walls of the arteries. What causes cholesterol build-up on the inner wall of the arteries? There are two causes, which are either genetic or excessive fat intake. What is the relationship between plaque formation and heart attack? The cells loses its sensitivity to receive and store cholesterol. Cholesterol is accumulated in the bloodstream. Arteries narrows or block, and the most important one is coronary artery that nourishes the heart muscle. The supply of nutrients and oxygen-rich blood to the heart muscle is disrupted, and this may result in a heart attack. So, accumulation of plaque in the inner wall of the arteries may result in a heart attack, since it will narrow your arteries and disrupt the blood, oxygen, and nutrient supply to the heart. Here we see three examples. The first one is the normal healthy artery with a normal blood flow. The second picture shows plaque deposits restricting blood flow. In the third case, we see that there is deposits of fatty materials called plaque built up inside the walls of the arteries, reducing or completely blocking the artery and blocking the blood flow. This case is called atherosclerosis. How can we treat cholesterol built up on coronary artery wall? The first treatment is called coronary angioplasty, and it's a procedure used to widen blocked or narrowed coronary arteries, using a balloon to stretch open narrowed or blocked arteries. In this procedure, a tiny balloon is inserted to the position of the block in the coronary artery. Then the balloon is inflated, creating pressure on the accumulated fat and stretching the artery wall. This opens the artery and improves blood flow. So as you can see here in the figure, in the first picture, a tiny balloon catheter is inserted in the blocked blood vessel. At the blockage, the balloon is inflated and the artery wall stretches. This will open the artery and allow blood to flow normally. Second treatment is used when there is a severe coronary artery disease, and it's called the coronary artery bypass graft surgery. In the case the plaque has built up for a while or calcified, doctors create a new path for the blood to the heart, improving blood flow by using a piece of healthy blood vessels from your leg or chest as a bypass grafts around narrowed or blocked portion of the blocked coronary artery. So, in this treatment, doctors leave the blockage in place, but they go beyond it and use a blood vessel from another part of the body and connect them to the blood vessel above and below the narrowed artery, bypassing the narrowed or blocked coronary artery. The second disease is the anorexia nervosa. What is this disease? Anorexia nervosa is an eating disorder characterized by an abnormally low body weight, an intense fear of gaining weight, especially in young females. So, people who have anorexia nervosa are very thin. People with anorexia nervosa place a high value on controlling their weight and shape using extreme efforts that tend to significantly interfere with their lives. So, to prevent weight gain or to continue losing weight, people with anorexia nervosa severely restrict the amount of food they eat. What are the evidences used to diagnose anorexia nervosa? When can we say that this person is having anorexia nervosa? First, control the amount of energy consumption severely to prevent weight gain by controlling the amount of calories consumed or vomiting after eating or by exercising excessively or taking laxatives and other medicines. Being fearful and anxious of being overweight or obese despite being underweight. Third, it also includes emotional and behavioral issues involving an unrealistic perception of body weight. What are the complications caused by anorexia nervosa? First, physical problems like severe weight loss, lack of proper growth, low blood pressure, osteoporosis, headaches, difficulty in concentrating, and loss of memory. Psychological and emotional problems such as fear of obesity, low self esteem, mood loss, obsession with food and weight, overthinking, and refusing to acknowledge the consequences of excessive weight loss. Behavioral problems such as exercising excessively, severely restricting food intake, social withdrawal, fear of gaining weight, aggressiveness when forcing food, and finally, repeated weighing or measuring the body, and frequent checking in the mirror for perceived flaws. And now, let's start by our assessment. Name the case in which human eats a large quantity of food, then force self-induced vomiting, hunger, obesity, gluttony, or anorexia nervosa. Anorexia nervosa. What is the consequence of coronary heart diseases? Obesity, losing appetite, decrease the supply of oxygen and nutrients to the heart muscle, or increase the supply of oxygen and nutrients to the heart muscle. Of course, decrease the supply of oxygen and nutrients to the heart muscle. That's all for today. Thank you for listening and watching.